talking the music world, of course, with the passing of rock icon Ozzy Osbourne at the age of 76. Just 2 or 3 weeks after his final concert. So quite a career, goes without saying. And look, he's left an indelible mark on the music scene for sure, and the rock and roll and heavy metal genre, which Sabbath really were on the cutting edge of it. If any of you, and I'm sure many of you out there were fans of Sabbath, you know that they were pioneers for sure. And what an amazing band, and what an amazing legacy that Ozzy Osbourne has left behind, and not only in the music world, but a pop icon, of course, with his reality television and his personality larger than life. And again, Ozzy Osbourne passes away at the age of 76. What an indelible mark on the music scene and pop culture in general. I just thought I'd note that, of course, Ozzy Osbourne. Again, people of my generation grew up listening to Ozzy and Sabbath, and again, something that perhaps you might want to weigh in on when we open the phone lines between noon and 1 today. What are your thoughts on the passing of Ozzy Osbourne, and where does he rank when it comes to importance in the rock world? Speaking of music, the permit that was issued to put on a concert by a controversial American Christian rocker at York Redoubt has been revoked by Parks Canada. Several media outlets in HRM are reporting this morning that Parks Canada was not putting the show by Chris Fauch, I think is how you pronounce his last name. It was a vendor, and that the federal agency has revoked the permit based on evolving safety and security considerations based on confirmation of planned protests and input from law enforcement. People living near the popular park raised their concerns about the singer and strong MAGA supporter who in the past has spoken out against LGBTQ plus rights along with abortion rights and ran unsuccessfully for Congress as a Republican in California. Tonight's show was to begin a tour of Canada that is scheduled stops in Charlottetown, Moncton, and Quebec City. So I think the fundamental question about all of this, folks, that I'd like you to weigh in on is, first of all, was it the right decision to cancel the show at a national park? And was it a mistake to allow it in the first place? And does this violate freedom of speech and expression? Because that's the counter to all of this. And that's linked into this story is freedom of speech and expression. And are people's attitudes about freedom of speech often linked to their own views? So that's something that I think that we have an inherent bias, right? That if we view things as being distasteful and not in step with our modern progressive society, again, our worldview and how we view the country and where we're at societally, then if somebody comes in and opposes that, and we don't believe in that, we don't believe that it's in concert with that, then sometimes freedom of speech can be shelved. Freedom of speech isn't always clean. It's sometimes it's difficult, and sometimes it can be a bit ugly. So does this violate freedom of speech and expression? And are people's attitudes about freedom of speech often linked, as mentioned, to their own views, and how far should it go? Because freedom of speech has limitations, right? It's not just open-ended, and there are limitations. And then you get into hate speech and disinformation and lots of layers to all this. So these are some things that I'm going to ask you to weigh in on when we open the phone lines. Between noon and 1 today, we have Dr. John Gillis and house calls. We'll be by for house calls between 11 and 12. Again, Dr. Gillis will be by to take your calls, health-related, of course, between 11 and 12. So, yeah, lots to get to today, and so we'll get some other things in the pile, as I always do, and hope to hear, as mentioned, from many of you later on in the show. I'd like to thank Vanessa Van Den Ness as well on the other side of the glass of the control boards, doing a fine job, as always. Now joining me for a chat is Dr. Margot Burnell, President of the Canadian Medical Association. Dr. Burnell, thanks for joining the show.
Good morning. Nice to chat again with you.
All right, so as Canada's premiers gathered in Ontario's cottage country talking tariffs and trade, you and other groups, healthcare groups, are looking for more conversation and dialogue around the fragile health system. And how much is that? Has that been on the agenda?
We have had great interaction with the premiers and many of their staff to ensure that healthcare is forefront in their discussions. We understand that healthcare is on the agenda for this morning. So they're listening, they're hearing, they're agreeing that healthcare is integral to a healthy economy. So we're pleased with that and look forward to working with the premiers, the federal government, on continuing that messaging.
Okay, so what are some of the key things that you think should be covered and discussed here?
We were really advocating to make sure that healthcare was at the forefront, recognizing that you need a healthy community to have a healthy economy, that the healthcare sector on its own contributes to the economy, employing 3 million individuals and contributing billions of dollars to the GDP. Healthcare is an innovative space, and we can certainly do more in Canada. We spend billions of dollars outside of the country, which we can repatriate and have pharmaceuticals and technologies developed within Canada. So we were bringing forward the need for a healthy community, but also strategies that the CMA can help advocate for, with building a healthy infrastructure, innovation across the country, and then it's a win-win situation.
All right, 3 million people contribute and work in the industry, which is really staggering number, and of course that contributes billions of dollars to the economy as you discussed. So outside of course the health sphere and the impact of a healthy society and a healthy community, I mean that is immeasurable, right? You can get into how much money the economy is stimulated by healthcare workers and healthcare spending, but then when you magnify that as to the impact on society and a healthy society, or conversely an unhealthy society, and the cost that results in, it's immeasurable, right?
Correct. We need to have good primary care. We need to have addressed the social determinants of health, food access, clean water. We need to look at preventing disease and managing chronic disease well. So all of that is very integral to a healthy communities.
All right. Tell us about the Canadian license for physicians and where you'd like to see that as an entity.
We are strongly advocating for a pan-Canadian licensure such that a physician registered in Nova Scotia who has the appropriate credentials and meets the standards for competent and safe practice would be recognized if they chose to practice in BC, do a locum in BC. So we're advocating that there be a registry where the standards are documented, and then each province would be aware that that physician was in good standing, and then they would be readily able to grant a license, and the person could proceed to practice within the province.
Okay, that's happened already in the Atlantic provinces, has it?
It has. We developed the Atlantic Registry, and that was at the request of the 4 Atlantic premiers, encouraging the colleges to proceed with that. It's worked very well. And we're hoping that the premiers from the Atlantic provinces will share that success with their fellow premiers, and that may come up in discussion later today.
Okay, and of course, the government's One Canadian Economy Act is dealing with territorial licenses and certifications for other occupations. So you're looking for that to be a priority here as well, right, for healthcare workers?
Right, that's a federal legislation. It didn't specifically include healthcare workers, but we're hoping that the provinces will adopt a similar recommendation. So we've been discussing this with both the federal government and the premiers.
All right, so can the provinces do that unilaterally, or do they need to get the federal government's blessing on that?
They can establish the pan-Canadian licensure and have the Atlantic registries. It just is another layer from the federal government that allows that to happen. But the provinces can do that through a pan-Canadian licensure and a Canadian registry.
All right. How about healthcare transfers and what the provinces are receiving? Obviously, more is always something that each province would like to see. But what are your thoughts on funding levels from the federal government to the provinces?
At this point, the premiers and the provinces are keen to make sure that their transfer dollars are intact, and hopefully they are increased proportionately over time. So they will be looking at discussing that. We feel that there can't be cuts to the healthcare dollars, and hopefully the federal dollars will continue to flow as per the bilateral transfer agreements. And that is a discussion with the premiers and with the federal government.
Right, staffing levels in general around the country when it comes to hospitals, we know in particular rural ERs are struggling to stay open. What can the government, or what should the government do to? I suppose these are all interlinked, right? All these issues are interlinked and have connections.
They're all interlinked, and what I think is important is we really need a human health resource plan. We need to identify what our current gaps are, and we need to be more proactive in figuring out what those gaps are going to be down the road 5, 10, 15 years. We've been very reactive trying to fill the gaps. The pan-Canadian licensure would be one solution for some of these emergency departments. Potentially, if you had a gap in New Brunswick, then there might be a physician from Nova Scotia that would be willing to come over. They have family in New Brunswick, for example, and would be willing to do a couple of shifts in one of those emergency departments. So trying to have solutions at multiple levels to all of these problems, hopefully all come together and the pieces of the puzzle become more cohesive.
Dr. Burnell, I appreciate your time. Thanks so much.
My pleasure.
All right, take care. Dr. Margot Burnell, President of the Canadian Medical Association. And speaking of this summit, Canadian leaders say they're not rushing to meet an August 1st trade deadline with the United States. Prime Minister Mark Carney says his government won't sign anything unless it's the right deal for Canada. He met with the country's premiers in Huntsville, Ontario this week to talk about trade negotiations as well as fast-tracking major infrastructure projects to help the economy. It comes about 2 weeks after President Donald Trump threatened to impose 35% tariffs on some Canadian goods if there's no deal in place by next month. And of course, we've been reporting this morning that the U.S. has inked a deal with Japan, and that has bolstered markets, in particular for the automakers and Mazda. And we know the Japanese automakers. This is great news for them, and a lot of uncertainty surrounding the auto sector for sure. So that is good news. I'm not sure what this means for the Canadian auto sector. I think that there's going to be some really, really tough times. There already are. We heard a report from Stellantis earlier this week that has lost hundreds of millions of dollars in this last quarter, and bad news from GM yesterday as well, as they're struggling to try and figure out how to navigate this new modern age that we're in when it comes to tariffs in the United States. And the auto sector, in my opinion, in Southern Ontario is in serious trouble. And I'm not sure what the federal government can do about it, because it's just, look, you're dealing with the United States, you're dealing with these tariffs and an uncertain market, and the cost of building cars in North America is extremely high. We know that because of labor and other issues as well. So who knows what's going to happen with the auto sector here in Canada. Anyway, nonetheless, we shall continue to discuss it and talk about it and cover it as things evolve. When we come back, federal impact assessments should be fair, transparent, and swift for all projects. That when we return. Federal impact assessments should be fair, transparent, and swift for all projects, not just the few favored by Ottawa under Bill C-5, states the Montreal Economic Institute, MEI, in a new publication. Krystle Wittevrongel joins us to talk with this director of research at the MEI. Krystle, thanks for joining the show.
Thank you for having me.
All right, so tell us about, for those who don't know about Bill C-5, what this new legislation encompasses.
So Bill C-5, which was passed just last month, it has two laws underneath it, or included in it, which one speaks to kind of the free trade and labor mobility piece, and then the other is the Building Canada Act, which is essentially fast-tracking what they consider projects of national importance, so major infrastructure projects that meet some criteria for designation to be considered nationally important, essentially.
Okay, so what are some of the concerns here with C5?
So what C5 institutes is a goal of a 2-year process for these fast-tracked projects. But what we're proposing is that all projects that are major projects in this country under the Impact Assessment Act should be SWIFT by default, not by exception, which is what C5 is really kind of putting forward as this exception phase. Because the Impact Assessment Act, since it's been in place in this country since 2019, it has essentially ground investment to a halt when we're looking at major infrastructure investment and, quality of life and all of the things we're facing right now. We can really see that investment is needed in this country, bringing investment back. So we need some of that certainty around regulation in order to do that. And C5 is more of an admission that the current regulatory processes are too burdensome. So we should have this for all projects, not just ones that are determined to be of national importance based on their criteria.
Okay, so who makes that determination whether it falls under the criteria of national interest? Is that Cabinet?
Yes, yeah. So they do have some criteria that it strengthens national autonomy or security, delivers economic benefits, has a high likelihood of success, etc. And so it is by Cabinet, but there's inherently an issue there that this could be a politically motivated or politically entrenched project, which really shouldn't be the case when we're thinking about a rigorous environmental assessment.
All right. So, in a perfect world, what would the legislation look like?
So, when we're looking at reform to the Impact Assessment Act, that's what we recommend, rather than having this C5 essentially to say we need to speed things up. Yes, we do, but we should go back to the legislation that's actually burdensome and cumbersome and creating these issues. And so when we look at the actual Impact Assessment Act itself, we really need to get tight on the deadlines and the timelines that are within that. So in Canada, since 2019, there's only been one single project that has made its way successfully through the entire Impact Assessment Act and agency to receive approval. And that took 3.5 years. But there's been no others. So there are inherently things within this legislation that are holding back certainty in terms of investment, but also just certainty in times of timelines and when people can expect to see the regulatory process unfold.
So is C5 an upgrade from what we had, in your opinion?
I think C5, it's more of an admission that there's something wrong with the current process. And so looking at that, we really need to wonder what can be done to the current legislation rather than having a handful of projects that are determined to be important. Why is that not the standard for all projects put forward under the Impact Assessment Act and under the major project reviews in Canada?
Okay, so when it comes to, I suppose, the legislation, the consultation is something that we hear a lot about, that not enough consultation has been done with First Nation communities in particular. What are your thoughts on that and that aspect of legislation?
So long, uncertain timelines don't help anyone, not investors or governments or Indigenous partners, who many of which want to participate in or benefit from major projects, in various provinces in the country. Different projects are proposed with differing levels of Indigenous participation. And so many Indigenous-led resource initiatives are stuck in limbo because the process drags on. And so a SWIFT by default model, where there are clear steps and timelines, we would actually see this strengthening Indigenous participation by offering certainty and partnership opportunities instead of some of this endless delay and moving goalposts. And consultation is a constitutional obligation, and the federal government absolutely needs to get it right and figure out how to make this happen. And so making a process that can actually help everyone is the ideal scenario.
All right. So when it comes to projects and investment, I would think that this would be very problematic when it comes to attracting investment and the huge dollars that are needed and the long game and the long scope in which is required, the long lens when it comes to investing in these massive projects. So what does a lack of a robust legislation or predictable legislation, I should say, what does that mean when it comes to investment?
Well, when we look at major project investment in Canada since 2015, so just a little bit before this legislation, the Natural Resources Canada inventory was at $711 billion of investment. And then just 8 years later, it was down to $572 billion, which is a $314 billion gap of planned investment. And that's a minimum. And so obviously it's not entirely the Impact Assessment Act's fault there, but it does play a significant role. And when investors are asked and surveyed on their investment decisions, the lack of clear, predictable regulation is often one of the most cited reasons for choosing another jurisdiction other than Canada in order to invest. And so we really need to do something to have that certainty piece back to attract investment and really start to turn things around in that area, because it's been a nosedive over the last few years.
All right. How about duplication? This is a challenge, is it, when it comes to getting approvals and assessments? Duplication.
Yeah, and that's one of the things that we actually recommend, is that the federal government should be recognizing the provincial assessments as adequate in order to avoid that duplication, because often they're assessing the same things to different magnitudes, and it's really an unnecessary consideration. And when we look at the one project that has been approved under the IAA, it was actually approved in British Columbia under what's known as a substitution process, where the federal government has recognized that British Columbia's environmental assessment is adequate. And so this needs to be rolled out with other provinces in order to speed things up and reduce some of that duplication, as well as respecting the jurisdiction of the provinces themselves.
All right, and also setting firm deadlines. That's another recommendation that you're put forward here.
Absolutely. So the Bill C5 is saying they should do these project reviews in 2 years, and what we're saying is that it should actually be 18 months for all projects. And this isn't completely unheard of. When we look at other countries like Sweden, for instance, they have an average processing time of about 18 months. So there's obviously different considerations in different countries, but it is possible. And in order to get to this 18 months, we can look at some of the things within the Act, like respecting that jurisdiction, and limiting the federal assessments to areas of concrete federal jurisdiction, narrowing some of the scope of criteria in which they are assessing. The Impact Assessment Act expanded the assessment criteria from the previous environmental assessment legislation. And some of that criteria is quite subjective, and it can draw things out for very long periods of time. And so there's ways to get to a firm deadline. It just needs to be reflected in the legislation.
Okay, Krystle, appreciate your time. Thanks for doing this.
Thanks for having me.
All right, take care. Krystle Wittevrongel, Director of Research at the MEI, Occupational Therapy Practice in Nova Scotia. What is it? What does it? Why is it important in the delivery of health and wellness in Nova Scotia? We're going to unpackage all this when we come back. An occupational therapy practice in Nova Scotia, what it is, why does it, why is it important in the delivery of health and wellness in Nova Scotia? So this is an awareness segment. Joining me here in studio is Marybeth Flemming, occupational therapist, been in the business for over 30 years, correct?
That's correct.
Okay, and on the line is Lisa Diamond-Burchuk, President, Canadian Association of Occupational Therapists. Lisa, thanks for joining the show.
Thanks for having me.
All right, so I'll start, Marybeth, with you. Just give everybody an overview as to what occupational therapy is all about.
So occupational therapy is a master's trained, regulated profession. It is OTs, or for short, will look at occupations and facilitating occupations with individuals who have illness or injury. And occupations are basically what you want to do, where you want to do it, and what you're expected to do. So, and it ranges from birth to death. So it's across all age groups.
Okay, Lisa, what's I guess, what would you like people to know about when it comes to awareness?
The key for me is that occupational therapists, we don't focus on diagnosing or symptoms. We focus on your life, right? And yes, you might have an illness or an injury, but what is it that you want to be able to keep doing to be yourself? And so that's where we go, whatever that is, and we figure out whatever hills you need to mount or barriers you need to surpass in order to be able to do that. So it's about having quality of life despite whatever's going on for you.
Okay, and what are some ways that you go about doing that?
Me? Yeah, I think there's a lot of ways. It's interesting you asked that, because sometimes it's about changing the environment, like finding what the environmental barrier is and making changes that way, like addressing the problem itself. But sometimes we can't really fix the problem. So then, or even anyways, it might be better to try and help the person to develop skills and strategies to be able to address the barrier. It's about giving them the tools and teaching them the tools so that they can be independent and have a meaningful life however they want to do it.
Okay, Marybeth, give me some tangible examples or perhaps some scenarios or cases that you've worked on over the years.
Okay. So I've worked in the private sector for a while, and I work with a lot of first responders who have had diagnoses of PTSD and similar diagnoses. Some of these individuals will refrain from going anywhere, and so from a social perspective or work. So it's trying to get them back to work. One particular example is a lady who wouldn't go to any stores, but yet it was the thing that she enjoyed the most was shopping and being social. So when I met with her, she wasn't working and she wasn't going stores, and literally she was staying in her house. So what we did is we worked on identifying what the barriers were, and then we put in place an exposure process, and then we gradually reintroduced her to her regular social environments, going to the beaches, going back to stores, and then we transferred that exposure into things that were related to work. And then before probably about 2 months into this, and about 3 months in total, she was back working at her occupation at a part-time basis. So that was one example. Another example would be an individual who lost the use of both of their hands, but yet their job, they required their hand use. So what we did is we went in and we adapted the environment so that anything that they needed to access with fine motor or grip, they were able to then use the adaptive equipment, and then they were able to return to work. And that would be the same for someone who has a stroke and wants to return home and wants to cook or bake or go to church. We would adapt the environment or give them the tools, like Lisa said, to be able to accommodate those and be able to overcome the barriers. The biggest thing about being an OT is finding out what's important to the individual, what's meaningful, what gives them hope, and what gives them purpose, and tapping into that and figuring out how do we get back to that feeling. So it's a mental health approach, but it's also a phys med approach, and OTs are trained in both areas. I always say when people say, well, what's an OT do? I said, somewhere between a psychologist and a physio. Everyone knows what a psychologist does, and everyone knows what a physio does. And we're trained in both areas, and that's what meaning is, and that's what purpose is being able to enjoy what you do the way you want to do it and contribute and have value and feel the value. So it's really important.
All right. And it seems quite broad, as you mentioned. Your skill set obviously needs to be quite broad. What's the educational requirements for an OT?
So there is a school at Dell, and it takes individuals from all over the Atlantic provinces, and it's a master's level trained position. So you'd need some sort of a degree, and there are, depending on the schools, there are different criteria and different courses that you need to get in. but it's a 2-year intensive program at DAL, and similar programs exist across Canada.
Okay, Lisa, from a human resources standpoint, is it like everything else a challenge to retain and attract people into the business and healthcare?
Yeah, I mean, it's across the board in terms of the healthcare human resources crisis. For sure, we are having, we're working on it. And so almost all of the schools have actually expanded their seats. Like where I'm in Manitoba, we've moved from 50 students to 60 students. We're all working really hard to try and fill that gap, because it's not, what happens is the roles for OT are expanding as we move into primary care, and the family docs are asking for our help because they can't possibly keep up with all the chronic disease that's, increasing. And so it's about, we have to try and keep up with the need.
How about funding for this, Lisa? How much of it is public and how much is private, and tell us about access as well.
Yeah, so it's a combination. There are a lot of therapists now in private practice, which I would say there wouldn't have been, say, 20 years ago, because there are so many third-party payers, right? There's your personal health insurance. You can often access it through, and if your personal health insurance doesn't give you access, then you should advocate for that and ask for it. But there's also, the insurance companies or workers' compensation. If you've been in a motor vehicle accident, there's lots of different ways that it's covered. But for the most part, it's more public. And it's not what everyone tends to just think about health, but it's also education. It's also justice. OTs are working in schools. A lot of OTs work in schools. A lot of OTs are working in the justice system. So those are the public funded positions. And so in terms of access, that's the part, right? It's about the government and the public funders recognizing where they need to put the money and recognizing that it's actually a cost-effective way for them to spend their money, that, if you can get an OT getting someone back to their life, and keep them independent or keep them in their homes. Aging in place is a really important one. So it is about getting the governments to recognize that this is a good place to put your money, which they've just started to do really across the country in primary care. They are recognizing that that's a huge priority. That's an area I've worked in myself. And we went from one occupational therapist in Manitoba to now there being 20, because the government has recognized, this is worth putting our money into, because that's a cost-effective way to help patients at that first point of contact in the community.
Hey, Marybeth, what's your take on this?
So it may be occurring across the province, across the country. In Nova Scotia in particular, that's not the case. So in Nova Scotia, there is an opportunity to work in mental health and addictions program, and we're equally trained with social workers. So we have a master's degree, we have the mental health training that a social worker has, but they're not being utilized in those programs. So it's been mandated that you have universal access to mental health and addictions, but OTs are not being utilized in that capacity. In primary health care, right now there is a program that the physicians are able to use, and they ask for allied health professionals, but it's driven by the docs, which is great for them, and it's supporting them. OTs aren't the driving force behind it, so they're not being used in primary health care. That's just starting. It's my impression, and this is my personal opinion, that we're not around the tables making these decisions in the province of Nova Scotia. We haven't been asked. There are lots of individuals advocating for these services on a regular basis in seniors' care. There's research to show that we can have people exit the health facilities 14 days earlier if you introduce and have access to home care and OT services. There's research that supports that physicians will see less patients. They'll have to see less patients per day if they have an OT working on their team. They could be doing fall risk assessments. They could be doing mental health screens. They could be doing aging in place adaptive equipment for seniors. I had an individual who had diabetes, and she also had arthritis, and her diabetes was at a check because she couldn't open the jars because of her arthritis. So the physician was having a really hard time with managing her diabetes, but she couldn't get access to her food to manage her own diabetes well. So that's the partnership that needs to occur, and that's not happening systematically or systemically throughout Nova Scotia.
And just why is that? Is that just oversight, or what's going on?
I can't comment on the reason. I know we haven't been brought to the table as a group. There are lots of people advocating for it. There was an individual who was going to come with me today, but she was in a new position. She's been advocating for 2.5 years, 3 years, trying to break into that role and be around the right tables. It's being around the right tables at the right time. And I don't think that has occurred in the province of Nova Scotia. Lots of precedents set for the rest of Canada, but hasn't happened yet to date.
Lisa, what's your response to what you just heard from Marybeth and the experience happening in Nova Scotia?
Oh, it's so frustrating to hear. And, we hear stories from across the country of both provincial issues, but also some of the more national federal issues. And it's so frustrating because it's ultimately the clients, the people, right, who aren't getting the best service because the governments or the people who are making the decisions aren't taking the time to make themselves aware and to understand. That's what I think the problem is. I think they just don't know about the scope of occupational therapy and don't understand the benefits. But because they're not taking the responsibility to find that out and to understand, people are being neglected in terms of not having access to an OT.
Okay, I just want to make sure that you get that you get out all the messaging that you want, Marybeth. So as we wrap things up, any kind of final messages that you want to give to people here about all this?
For clients that are out there that have family members that think, this is interesting, ask. And ask your family physician, ask your healthcare provider, your Blue Cross or whatever, your insurance provider. Yeah. Ask your physios, ask your speech language pathologist. What's this about OT? Could it help? And for the politicians, ask and say, how can you help make the health and wellness of Nova Scotians universally better? Regardless of where they live. There's a lot of OTs in the province that are in the central region, but, northern Inverness needs OT services just like Yarmouth.
Sure.
So the politicians should be asking, how can we as a group facilitate health and wellness?
Lisa, any parting words that you'd like to let people know about?
Yeah, I just agree with Marybeth. That's what I'm always telling families. You can ask for this. You can demand it. You can refuse to take your elderly parent home from the hospital. Say, I'm not taking them home till I have an occupational therapist do an assessment and help me make sure that she's going to be safe when she goes home, right? Just ask for it. Demand it. You have the right.
Okay, Lisa, appreciate it. Thank you for doing this.
Thank you.
Okay, Lisa Diamond-Burchuk, President, Canadian Medical Association Occupational Therapist, and Marybeth Flemming, Occupational Therapist. Marybeth, thanks for coming in. Good chat.
Thanks for having me.
All right. We'll be right back. All right, Nick Horne is a Westwood Hills resident in the Halifax area and former Vice President of the Community Residents Association. Nick, thanks for joining the show. We appreciate your time.
Morning, Todd. How are you?
I'm well. You?
Great.
All right. So you recently wrote a letter to Mayor Fillmore and inadequate HRM fire response and policy gaps, writes Lakewood's fire incident. Tell us about what motivated you to write this letter.
Okay, so last Friday evening, I was out in my canoe with my dog, who absolutely loves canoe rides. We just usually go scoot around the lake and go on an evening tour around sunset. And I smelled smoke, and it was one of the red days for Nova Scotians where we're not allowed to burn. So I immediately started following my nose across the lake, and I found a campfire that had been poorly extinguished. HRM fire estimated several days to a week old. It was about 15 feet in diameter, and it had burned 12 to 15 inches into the ground, actively, like no real like huge flames, but smoldering low flames on some branches and trees and stuff. And there was 2 full trees actually in the middle of this circle of fire. I called 911 immediately and asked for the fire department to attend and put it out. I got in my canoe, and on my way back, I got my neighbor to get my boat ready, mainly because in the 17 years I've lived here, I've personally put out 5 wildfires around the lake, just like small campfires. People don't put them out, and this is what happens. So in the past, I have been asked to ferry the fire department with their small pumps and their equipment over to where it is, and then they put it out. This time I got back to, by the time I got back to my dock, the fire department was waiting there, and they indicated that they do not get into private vessels anymore. And because it was getting dark, they are unable to respond. I mean, a lot of us went through this in 2023. We're traumatized, and we're certainly more diligent than most when it comes to wildfires and risks. So the fire department left. They left, and I'm not faulting the firefighters themselves for this. They're only following their own policies and directives. I hold no ill will or bad thoughts against the people who responded. My father was a firefighter for 20 years with Beaver Bank pre-amalgamation, so I understand what they go through for sure. But that said, we were forced to get buckets and, as residents, go put out this wildfire before it, grew in size, and it only would have taken some wind to take that whole island out that it was on. It was very close to shore, and as you know, in 2023, the wildfire jumped Stillwater Lake, so we were quite concerned, enough to spend 3 hours with buckets to put it out. After I got home, obviously I put pen to paper and wrote a letter. I have better expectations from the fire service. I have some expectations that they will learn and grow from this and provide the firefighters with tools that are available so that in the event that this happens again, they can assess. They can maybe fly a thermal drone over and assess that way, or maybe they need more boats. They need the tools to do the job properly. They shouldn't just have to turn tail and run. Another point in my letter that I highlighted was there was a gap in custody. Overnight, they had left the fire and nobody was looking after it. It was probably on paper back at the office, but there should have been a custody transition if they couldn't respond themselves. They should have called in DNR, maybe a helicopter, something to ensure that we were safe overnight, aside from us having to use buckets, obviously.
Okay, what else is in the letter?
The other thing that I highlighted that's of main importance is really for you and me, Todd. I think that HRM has a duty, obviously, to have the tools for themselves to put out fires. But in bylaws, it does state that if you're going to have a campfire, if you're going to have a fire in your yard, in the woods, wherever, you need to have the tools available to put it out yourself. And clearly this was a case of somebody not putting out a fire enough. So with that, I think that HRM or the province or both should undertake an advertising campaign, increase awareness of what is needed to be on site so that you can effectively put out your campfire when you're done with it.
Yeah, on the idea of boat transfer refusal, might there be some liability there? I would think perhaps that might be an issue.
Absolutely, yeah, and like I said, I don't fault the firefighters for refusing. We live in a day and age where lots of things happen legally that wouldn't have happened 20 or 30 years ago. That 20 or 30 years ago, people would have just said, "Hey, can I borrow your boat?" and that would be it.
Mm-hmm.
But if they don't have enough boats, they should buy more boats. It's very simple.
Mm.
They had to wait for a boat to come from Sackville, which is 40 minutes away, and in the meantime, it got dark and they couldn't do their job.
Yeah.
So perhaps there should be a boat in Tantallon or in Hammett's Plains. The radius should be smaller for having a boat available, because this is a gap that was highlighted.
Any response from the mayor?
I've had a response from Councillor Hartling. She said, "Thank you for your letter. I'm working on a lot of these things already." So clearly, some of the gaps are known and they're working on them, which is great. Councillor Hartling thanked me for what we did. She thanked myself and the residents for what we did to help put the fire out. And I had a response from Kara McCurdy as well from HRM Fire along the same lines. She's taking the letter seriously, and she thanked us for putting them out. And she did highlight, she said, if you guys had done nothing, it likely would have flared up. So there's an admission there that this was serious enough that, more should have been done. And going forward, I expect these gaps to be filled for sure.
Okay, appreciate it. And we'll talk again, Nick.
Thank you.
All right, take care. All right, Nick Horne, Westwood Hills resident, former vice president of the Community Residents Association. Now we've got some time for you. If you've got some health-related calls, Dr. John Gillis. If you've got a health question, give us a buzz at 902-405-6000. Again, if you have a health concern or a health issue that you would like to ask the doctor about, 902-405-6000. House calls with Dr. Gillis when we come back. All right, it's time for House Calls with Dr. John Gillis. The way to reach us is 902-405-6000. Again, 902-405-6000. That is the way to reach us. If you have a health-related question or concern, Dr. Gillis will do his best to impart his wisdom. 902-405-6000. That is the way to reach us. Again, 902-405-6000. Dr. John Gillis, welcome to the show as always.
Hey, sir. How we doing?
I'm doing all right. You're getting set for a trip to Ireland in a week or two, are you? Is that correct, if memory serves me here?
Yeah, a couple weeks, yep.
Nice. That's and family and friends over there, right?
Yeah, I got a few friends over there. We're going to see a music festival, so it should be good.
Awesome stuff. Good stuff. 902-405-6000. That is the way to reach us. Again, 902-405-6000. So earlier in the show, I chatted with a couple of guests who were occupational therapists. I chatted with the Canadian Association of Occupational Therapy and an occupational therapist here in Nova Scotia. She's got 33 years experience. And it was awareness piece about what occupational therapy is, and it was eye-opening for me, and I think for a lot of people listening, as to what the role is of occupational therapists. What are your thoughts on their role in the healthcare system? I think overlooked, perhaps. What are your thoughts?
I think probably not as well understood as they could be. I think they play an important role, and I think a lot of people don't really understand what they do as in terms of helping people, do rehabilitation, integrate back into their lives, into workplaces, just help people, live the way they want to live. And, but it's a lot more than that too. It's quite a breadth of activity, things that they are able to do and help people with.
Yeah, for sure. And when it comes to healthcare, we often think of acute healthcare or primary healthcare, certainly the things that you provide and people like you, and ER is obviously something that is at the forefront of people's mind when they think of healthcare, but it is so broad, right? I mean, you get into dental care, you get into vision, you get into audiologists. It's such a broad scope that I think too often doesn't get enough attention, enough funding, and enough access. What are your thoughts?
No, I think that's very fair, and a lot of this stuff does come back to the funding. occupational therapy, much like physiotherapy in hospitals, is covered, but outside of the hospital, you're not going to necessarily get coverage unless you have private insurance, and that's part of the problem. It's as we look at expanding coverage to things that can not only help people but save the system money, it's important to look at those things.
Yeah, and what advice do you give to people when it comes to being your own advocate in the healthcare system? Because that's not easy for some people to do, depending on what their personality is. But I think it's important that people somehow find the ability to advocate for themselves and ask these questions and find out what's available to you, if at all possible. What's your advice?
Yeah, I mean, the internet's your friend, and it can also be your enemy. But trying to understand the breadth of allied health professionals that can help people with certain problems is important, and understanding what coverage you have, and also talking to any provider that you do have to say, look, what are my options here to treat this problem? Is it just coming to see the doctor, or what else can I do here? Asking questions and understanding and communicating. Sometimes physicians, NPs may not think about other options to help. They're busy. It just doesn't cross their mind, or it gets forgotten. So asking those questions is
Hello, you still there, Dr. Gillis? We lost you.
Yeah, no, I'm here.
Okay, good. Okay. All right, fair enough. 902-405-6000. That is the way to reach us for house calls with Dr. Gillis. If you've got a health-related question, now's a great opportunity to get some advice from Dr. Gillis. Again, 902-405-6000. That is the way to do it. Again, 902-405-6000. Also, earlier in the show, I chatted with the president of the Canadian Medical Association and Dr. Margot Burnell from New Brunswick, and she was talking about some work that they're doing when it comes to lobbying the premiers who are meeting, and they met with Mark Carney, of course, this week as well in Ontario's cottage country, and talking about the importance of health care. And one of the things that they're advocating for is allowing doctors, and you and I have talked about this a lot on the show, but for those who are new to the show, it's good information. But talking about having licenses for doctors be transferable within provinces, and the administrative burden and the costs and barriers that are established by that. So you are a strong advocate of that. You're licensed in a few provinces. So here in Atlantic Canada, is that the case now that you can automatically transfer your license, or is that still not the case here in Atlantic Canada?
No, it's actually quite good here in Atlantic Canada. I have a Nova Scotia license, but I think I pay, a few dollars every year, and that extends me to Newfoundland, New Brunswick, and PEI. And that's helpful. I mean, we have patients who move between those provinces in the summer or for work, and it's made it a lot easier to help them out. But I don't have to apply. Now, there's still some red tape with that. Those provinces still have their own regulatory bodies, and of course you're subject to their oversight, which is a reasonable thing. But this shows that this can work, and hopefully it gets extended across the country. I also keep an Ontario license, which I've kept since I was there, and that's been helpful. I don't use it as much anymore because I don't do the rugby work in Ontario, but at least not as much. But it's still helpful. But to be able to move about and have different options, I think we're heading that way. I just hope it moves along.
902-405-6000. Kathleen's giving us a call. Hello, Kathleen.
Hi, good morning. How are you, Todd?
Doing well.
That's good. I just wanted to talk to the doctor there for a minute.
Yeah, you're on.
Hi. My daughter's been a couple of times to the emergency because of a pain that she has in her lower right quadrant. They've done all the tests and everything, and but they haven't been able to tell her what the problem is, and she was basically referred to a specialist. But that was something like 2 years ago, and she keeps having the pain, having problems suffering through the night with it occasionally and everything, but it comes for a while and it goes away and everything. They basically have to do some sort of laparoscopy or something like that in order to figure out what's going on, because they've done a number of tests and said, oh, it's okay, you don't have cancer and all that sort of thing. But when you're there and you get referral and you don't get an appointment within a 2-year period and you're still suffering from the same pain, what are the options? What can you do about that in the system?
Well, yeah, there's a couple ways to look at that. I mean, we see a lot of people in Emerge who have pain that has been investigated, out the yin-yang, and nothing comes back. I guess unfortunately, the way I look at it through an ER lens, but I also look at it through a chronic pain and pain treatment lens. There are people who have, abdominal pain conditions or other pain conditions that may never show up definitively, on any test. And they spend years chasing tests and or sometimes surgeries when somebody should probably be focusing on helping them come up with a plan to actually treat their pain or their flare-ups or attacks. Not that we should ignore testing, but again, not at the expense of, hey, you're in pain, let's see if we can get you feeling better, even though we're not 100% sure why after we've ruled out the bad stuff. So I do see people who have had a pile of scopes and a pile of, exploratory surgeries, which actually may make them worse because of scar tissue. So there's a real fine balance there of, chasing waterfalls when the...
Well, we are thinking it is scar tissue possibly because she had a ablation, many years ago as a young. Once she was done having her kids and everything, she just had that done, and she apparently she continues. She has started to have periods again, and that shouldn't have started. Like in some ways, I guess that's not. I guess it can come back after a while. But we think that there's some, possibly like fibroids or something like that, maybe. But we're wondering. I don't know. When it takes up the time for her to lose sleep at night and not able to handle the next day's work because she's losing sleep over the pain. She also can't take a lot of pain medications or things like that. So she's probably not going to be a candidate for that. But we would like to know what's going on. And so you kind of go into a dark hole sometimes when you go to and they say, okay, you're in a waiting line for a specialist so that, we can scope or whatever you have to do. And you just never seem to know where you stand. And you're continuing to, I get what you're saying, that, sometimes they just can't come up with a solution.
Yeah, so look, I don't think there's an easy answer to what you're asking, but I mean, if you're waiting on some sort of follow-up, continuing to check on that, looking at a cancellation list, that sort of thing, is reasonable. But again, if she can't take some pain medications, that doesn't mean she can't take any. Explore the options so that she knows what to do if she has an attack. I see people all the time who come to the hospital, they've been having intermittent attacks of belly pain for years. They've had every test known to humanity. And some of them even have pills at home. They just don't take them. They just come to the hospital. And I
was trying to get her to go and get them to do tests for Crohn's, but she says they've because my mom has Crohn's, I have Crohn's, and I said, it sounds very much like my Crohn's pain. But she said they've tested for this and probably through blood testing or whatever. But for myself, it took them 30 years to figure out what was wrong with me. Between irritable bowel and other things, for the longest while they were like, it's irritable bowel, but what it really was Crohn's. and it was just not noticeable until the damage was done. And so I've been trying to get her to get in there and get something done about it. But anyway, I just was kind of interested to hear what you had to say about when you go into the black hole of waiting for, a specialist appointment for this, and how, because sometimes when you go in there and you're a female, they just don't want to listen to you.
Okay, Kathleen, we're up against a break. Hopefully that helped.
Okay.
All right, thanks.
Thanks.
Take care.
Bye-bye.
902-405-6000. House calls continues when we come back. Friends, House calls is Dr. John Gillis. The way to reach us is 902-405-6000. Again, 902-405-6000. If you have a health-related question or concern, give us a buzz now at 902-405-6000. Before we go back to the phones, Dr. Gillis, you had a follow-up that you wanted to mention?
Yeah, no, I appreciated the last call, talking about some of the challenges, assessing chronic pain and, conditions that aren't worked up. The last comment that, females who don't have pain don't get taken seriously in the emergency room, I must say I object to that. We see all shapes and sizes, men, women, big, small, all different races, religions, and everything else. And I think I've never seen anybody who just says, oh, you're female, you're in pain. We're not going to take that seriously. Pain conditions present obviously different in women with different anatomy. Chest pain can present differently. So we sometimes are more diligent because, women, for example, can have heart attacks that are more subtle, or chest cardiac issues that are more subtle in men. So appreciated that chat, but I'll have to record my objection to that last statement.
Okay, fair enough. 902-405-6000. Marie, hello.
Hi, how are you today?
Doing well.
My question is about radiation therapy and how safe is it to do radiation therapy on a patient that has a large hematoma in that area?
That's a tough question to answer. It depends on what the area is. It depends on what the underlying condition is.
Okay. Well, I could give you some detail if you want to know. I had a lumpectomy 8 weeks ago. I have a large hematoma. I'm scheduled for radiation therapy on Tuesday, and I'm concerned.
And have you asked the radiation oncologist about that? Have you?
I have, and she said to go back to my surgeon and get released from my surgeon. I went to see my surgeon, and she said I'm an overachiever with fluid, and to go have the radiation.
What overachiever with fluid means? I can only.
She drains it blows back up again.
No, fair enough. I don't deal with treating breast tumors either surgically or with radiation.
Okay. Should I advocate to the radiologist first before I go?
I think I would see. Go ahead,
Marie. Before
treatment, should I go and make sure I see the radiologist again? The oncologist radiologist?
Yeah, if you're concerned, radiation penetrates, the whole point of radiation is that it penetrates tissue and fluid. The way I understand radiation is I think a hematoma is going to stop it from working. But if you're concerned about it or you think it's going to cause excessive pain or something, I think it probably is worth just confirming that with the radiation oncologist and just to ask the question. I think that's a perfectly reasonable thought.
Okay, that's what I'll do. Thanks very much.
Okay, thanks. 902-405-6000. John, hello.
Hello, John. Hello.
Hi, is this John or?
I like to relate something to the doctor and ask him what he thinks of it. My wife fell down 2 days ago, and her leg started to swell up down towards where the ankle was. So I took her down to the emergency ward in Halifax at the infirmary, and unfortunately, we sat there for 14 hours before she was finally looked at. And they x-rayed it and everything, and they found that they said that they don't think it's anything broken. It looks like it's just a swelling and everything. And so you can go home, elevate it, and put some ice on it. So we did that. The next day, they called from the emergency and said, we think you should come back again because we've seen a few things on the x-ray that we're kind of concerned about that might show that you do have a fracture and they might have to deal with it. She said, okay, I'll come down. And you would think that after spending 14 hours there, if you had to go back for another consultation, that they wouldn't keep you there very long. They would look at it. Of course, this did not happen. So we went down and we sat there for 3 or 4 hours again, and nothing happened. So we asked the people there, how long are we going to have to sit here? We just came back because we were told to come back. They said, well, unfortunately, we can't do anything about it. We just have other people that are ahead of you. So we sat there for a little while longer, and so my wife was getting she's 83 years old, and she's she's very uncomfortable. So she decided not to stay anymore and decided to go back home. And so that's what we did. We went back home.
Well, do you have a question?
So I want to ask you a question, Doctor. Don't you think that if you were called back after having spent 14 hours there, that you would be dealt with a little bit quicker? Would you think so that would happen? What do you think?
Ideally, yes. And, we do try to do that. And, I was in Dartmouth yesterday. We had a couple of callbacks, and, we'll try to keep an eye for those things if we can. But sometimes the place is just burning down, and, we're hours and hours behind. There's resuscitations. There are critically ill people, and, sometimes it gets lost because the place is overwhelmed.
I understand that. But after spending 14 hours, my God, and then spending another 4 hours. So she didn't stay. I took her back home because she was too uncomfortable, and I had her elevate it and ice it more and that. And so that's where I stand right now. I just thought that you would think. I've talked to people that have gone to the emergency to Cobequid and to the Dartmouth General and Hospital, and they said that's where you should have gone because they're much more efficient over there and they're very fast. Anyway, that's my story for today, Doctor, and that's all. I thought I would have thought that there would have been a little bit more concern and get her to look at it after spending 14 hours. Okay,
we get you. Dr. Gillis, any parting comments?
Yeah, no, that's all. Thank you very much.
Okay, Dr. Gillis, any parting comments to the caller?
No, I think the point was repeated maybe 5 times there.
Yeah.
We do try, but, Halifax in particular is a regional trauma center. They're absolutely overwhelmed, and, they do their very best. But they're getting not only everything from HRM, the trauma, but they're getting everything from across the province and in some cases across the region. And it's a bloody shit show someday. There's no sugarcoating it. And, we try. I come on some nights and I'm like, well, how are these people sitting here for 10 hours? But then you look at, it's just the volume. There's been 200 people show up that day, and we just don't have the space to see them. And it just gets overwhelming. But, it's not like, our distinguished colleagues at the QE2 are sitting around having a smoke. They're run off their feet and they're doing their best. And I get that it gets frustrating, but the point of anger should not be the docs, nurses, and medics there at other hospitals that are flat out. It should be the points in the system that have taken us here. And sure, we'd love to be able to come out and see everybody in 10 minutes and send them on their way, but that's not where we are. And it's a systemic problem. And when things are bad, the serious stuff, the trauma, the heart attacks, the strokes, they obviously take priority. And, I get the frustration, but it's not just a matter of saying, oh, well, it's been 14 hours. They should drop what they're doing and come see somebody. It just unfortunately doesn't work that way. Yeah,
for sure makes sense. 902-405-6000 if you've got a health-related question. Give us a buzz now. Get some mobile line free at 902-405-6000. House calls continues when we come back. All right, House Calls with Dr. John Gillis continues. The way to reach us is 902-405-6000. If you have a health-related question or concern, give us a call at 902-405-6000. It's just as simple as that. Again, 902-405-6000. Gord's giving us a call. Hello, Gord.
Yeah, good day. Thanks for taking my call.
Sure.
I understand you're both well because you get that asked all the time.
Yeah.
But I have a question for the doctor. At your pain clinic, do you see and treat Veterans Affairs clients for chronic back pain?
Oh, yeah. I mean, we treat people regardless of where their referral source is from. So, yes, absolutely.
Okay. And how do I go about getting referred to you? Through my GP or?
That's correct, yeah.
Okay, I can do that. And because I've seen like Veterans Affairs sends me now to a chiro, massage, physio, and they treat the acute pain, but the chronic pain's been there since the mid-'80s. And to go with that, I had a spondylolisthesis, I think it's called, where the discs overlap, and they did put nuts and bolts in there to give me a backbone, a straight backbone. So I've had that as well. So I guess the two can go together. But okay, so I'll see my family doctor and see if I can get a referral to your clinic.
Yeah. Sounds reasonable.
Thanks, Gord.
Thank you.
All right,
Thank
take care.
Very much.
All right, 902-405-6000. That is the way to reach us. Again, 902-405-6000. If you have a health-related question or concern, we've got the doctor to the top of the hour. Got some open line for you as well. Again, 902-405-6000. We've talked quite a bit in the past about Ozempic, and a story that I saw recently on the CTV website. I thought I'd get your take on it. Again, while we await some more phone calls. Again, the way to reach us is 902-405-6000. I'll read a bit of the story, then I'll get your opinion on it. Prescription weight loss medication use has been linked to significantly higher rates of eating disorders in adolescent boys and men, according to a new study. Led by an assistant professor at the University of Toronto, the study focuses on often overlooked population and raises new concerns about the use of high-profile medications like Ozempic and Wegovy for weight loss. Dr. Gillis, what's your take on Ozempic and Wegovy in general, and their efficacy, and what are kind of broad strokes thoughts on this?
Yeah, I mean, they can be helpful, and for some people who have metabolic disorders and who've tried everything else, they're quite useful. But they've also become, for lack of a better word, a bit of a crutch. People think that this is all they have to do. People that doesn't apply to, that don't have metabolic problems, that haven't tried things. And to be very clear, some people need it, and it's been a godsend for some people. But for people who just think, look, I've not done anything, I've not tried to change my diet, I've not, tried going to the gym, I'm just going to take a shot. It's not a long-term solution. There are side effects, and I think it needs to be a package deal of how we approach fitness and weight loss, and not just like many things in society rely just on pills. Some people need them. Some people need these treatments, but it's not a panacea for everybody.
902-405-6000. Greg, hello.
How you doing? Good to see you.
Yeah, thanks.
Doctor, I just wanted to comment. I've talked about my mother before, but she's 88. So what happened is they did a scan, whatever. They found 2 spots on her liver and 1 big spot on her lung. So, I mean, she's got COPD, emphysema, 28 years, 28% lung capacity and a pacemaker. And I think you said it before. Where do you draw the line and say, okay, this is enough here? Because I've convinced my sister. I said, why are we going to put Mom through all this stuff? Because there's just no way it's going to rectify anything. So my question is, where do you draw the line and say that's enough?
Well, who's making the decision? Is your mother competent to make that decision for herself?
Well, Deborah, my sister, and me, we sort of like do it together, and we try to tell Mom, Mom, no, don't do that. So we pretty well got her convinced that, well, maybe not, no, because there's so many side effects to this stuff, and and she's just not going to be able to. She's not going to be able to get through all this stuff. And 88 years old. I mean, we're not going to say much here. It's Is it close to the end? Maybe it is. Who knows? But because they did say the COPD is going to start getting worse and worse. And so I'm just saying that you said one time, where do you draw the line? And I think we're probably at that point we're going to draw the line there.
Yeah, it's an important conversation to have amongst family members. I mean, sometimes we see a conflict. Sometimes we see a patient who wants to do more and the family wants to do less. Usually it's the other way around. Usually it's the patient who's like, all right, I've had a good life. I don't want to be put through this, and, family for, different reasons.
Yeah.
Usually it's just caring. They don't want to lose mom or dad. They don't want to let them go. And, we see it far too often. I mean, doing CPR on an 85-year-old woman whose ribs can't handle it is inhumane, but, people ask us to do it. Yeah. And, what it comes back to is having a conversation about, what is the possible upside, what are the risks of doing a procedure. Pacemakers are pretty benign these days. They're not nearly as invasive as they used to be. But, I would have that conversation with your mother, your sister, and the physicians that are involved and say, look, we don't want to do too much here. Is this humane? Is this the right thing to do? And try to come up with a consensus is what I would say.
Yeah, because that's exactly what we're leaning to, because I talked to my sister a long time the other night, and I said, look, let's not beat around the bush here. The doctor did say her COPD is going to get worse soon because it's taking its toll on her lungs. So anyway, but like I said, that's where we're at. And we kind of feel like maybe it is time to say, okay, enough's enough here. Because the last thing I want to do is put my mother through all this stuff, and just for what? So anyway, thank you very much, sir. I do appreciate it, and I'll take that.
Okay, Greg.
Thank you very much.
Thanks for the call. Take care. 902-405-6000. Vanessa, hello.
Hi there. How are you?
Doing well.
I just wanted to touch on the last caller there, the woman that was saying about waiting and waiting. Like, I've been diagnosed with endometriosis. I have fibroids. I'm going through early menopause, and I have to wait, and it's the way it is. There's so much out there that can help people in between this. While you're waiting, if you look for the research, I own a med spa in Bedford, and I also have a lot of clients on Ozempic, and everybody thinks this is going to save them and they're going to lose all this weight, and they go on it, and a lot of people end up really sick because they're on it for the wrong reasons, and the people for the right reasons, I see great results. So I think people really got to start doing more research and seeing what's out there, and like the naturopaths and people like that, they help a lot with the women's stuff. They really, really do. I just wanted to touch on those topics and get a little opinion for you guys.
Okay. Dr. Gillis, any comments?
Well, I think that's a fair comment. I mean, that's what I typically say to people is, there's rarely a magic solution to anything in particular. And, these drugs are good for some people and not for others. And you have to get a balanced opinion. I do think the naturopathic community can be very helpful for, women's health issues, menopause, and a lot of these things. I wish we could work it out so the naturopaths could do their own blood work and not ask us to do blood work for stuff they're doing. That does annoy me sometimes because I'm not treating the patient, but I'm being asked to do blood work. And, I think they should have that ability to do it themselves, and hopefully we'll get there. And it's not that I don't agree with what they're doing. It's just, don't asking me to follow blood work on something that I'm not treating and or expert in can be a challenge.
I can imagine that is. And I know I know it's going to be hard to differentiate that because like a naturopath isn't your doctor and, but I do feel that it gives you some more insight on ways to keep yourself from being in pain while you're waiting for these appointments and stuff, right? So just any women out there suffering, there is ways out there to help you get through it. You just got to do the research.
Okay. Thanks, Vanessa.
Thank you very much.
Okay, take care. All right, 902-405-6000. Alan, hello.
Yes, hi. Question for the doctor about Ozempic. Mm-hmm. I'm a type 2 diabetic, and I've been on, pretty much maxed out on all the diabetic medications you can have on a daily regime. The Ozempic, I've been on the Ozempic now for going on seven years almost. And I understand you say it's not a long-term, designed to be a long-term magic drug or anything like that. But was that more or less for weight loss, or was that more or less for overall in general? Like, should I consider maybe, not taking the Ozempic anymore, or is it actually doing any good anymore? I don't know.
Well, no, it's a fair point. So, I mean, I think Ozempic hasn't been out all that long. There's probably not very many people who've been on it in Canada for that long. And you were probably put on it because it lo and behold, it came out 7 years ago. I just looked it up, January 2018. So it's a diabetic drug. You were put on it because you're a diabetic. You were not most likely put on it for weight loss because it wasn't being used for that at the time. Very early on, and even in some of the studies right when it was being released, it showed that people were losing weight, and then it got seized upon, kind of off-label for non-diabetics that, wonder if this will help lose weight. So the summary of that is it sounds like you were put on it for appropriate reasons. It may or may not remain the right drug for you, but you don't need to come off it just because of, what's been happening with other uses of the drug. You may need a review to see what's best for you in the long run. But, an interesting point you raised because, literally this is a diabetic drug. This is not a weight loss drug. It's just when people started using it to control their blood sugar, in some cases, in many cases, weight started to come off people much more than it did with other drugs. And then somebody said, well, I wonder if that'll work for non-diabetics. And in some cases it does. So hence the beginning of the craze. So, but sounds like you were one of the first in the line.
Yeah. Okay. All right. Thank you, Doctor.
Okay. Good luck. Take care. 902-405-6000. Chuck, hello.
Hey, how you doing, guys?
Doing well.
Good. This is for the doc. Hey, just a comment. Listen, man, you must sometimes use a shot put as a stress ball. It seems like they shoot the messenger so many times. Recently, 3 years ago, I released from the military, retired, and I just got a doctor. I understood that when I left, that it's going to take time. My hat's off to all you guys, all the medical staff, whether logistical or doctors, nurses, paramedics. I just spent a couple of days in the hospital after an accident, and the way you guys work, man, my hat's off to you. Keep up the good work and stay positive. Thank you.
Okay. Dr. Gillis?
No, I just appreciate that. It's nice to hear it. And, you've just heard me say a few times, I'm only in the hospital part-time. And, some days when I leave, I'm just ready to, wring my hair or whatever. But, the nurses and the docs that are there much more, you can see the stress and you can see the strain. And, when, the complaints, which, are, on the surface reasonable, people are frustrated that they've been there that long, but they are, to borrow the phrase, shooting the messenger. It's not like we're sitting around eating pizza and smoking out back. People are running off their feet and they're doing their best. And if you want to blame someone, that's not the place to look.
Fair enough. 902-405-6000. We've got the doctor to the top of the hour. We got some room for you as well. 902-405-6000. House Calls continues when we come back. All right, got a few moments for house calls left with Dr. Gillis. 902-405-6000. Brenda's giving us a call. Hello, Brenda. Hi, Brenda. Brenda, are you there? We'll put Brenda on hold and go back to her. Joe, hello.
Hey, guys. Thanks for taking my call.
Sure.
Dr. John, I'd just like to reiterate the last caller's call. I know you guys work like heck, so we'll leave it at that. Props to you. My issue is I wake up in the morning and I'm covered in sweat. Like it looks like I got out of a pool kind of thing, like my shirt's soaked. And I'm wondering what that might be related to, whether it's blood pressure or my sleeping pattern or, I don't get a whole lot of rest. So, it could be that, but, there's obviously life issues, but I'm wondering what I can do in terms of maybe seeing how I can resolve this.
Well, you probably want to start with some basic blood work. Thyroid issues can do it. In women, menopause is a common cause. It doesn't sound like that applies to you.
No.
abnormalities with, blood counts and certain disorders can do it. It can be something as simple as, the climate in your house. It can be it can be an allergic response. So, optimize your sleep environment, make sure the temperature's right, make sure the blankets, what you're wearing, all that stuff. I'm sure you've done all that. And then you probably want to start with getting, some blood work done to check your blood count, your sugar, and your thyroid as a starting point, to see if there's any abnormality there.
Okay. All right. I've always been really healthy. I don't know what would be an indicator of a thyroid issue. I mean, the blood work obviously was going to tell me something different, but what would, I'm not sure. Is there any indicators that you can say that, okay, we understand this is a pattern that kind of goes around the thyroid thing? Because that's something I haven't explored at all. So,
yeah, I mean, there's people whose thyroid levels are too high. Sweating is one of them. Weight loss, change in your hair, feeling kind of jumpy, sleep disorders are some of the big ones. So, but a simple blood test will tell you that. Okay. So that's probably where I'd start.
All right. Thanks very much.
Okay. Good luck, Joe.
Pretty informative. All right.
All right. Guys. Take care. You got it. Let's try Brenda again. Brenda, if you can, quickly, please. Brenda, are you there? No, Brenda. Okay. Dr. Gillis, great stuff as always. Thanks, my friend. Appreciate it.
Take care, my friend. Bye-bye.
All right. Take care. That's Dr. John Gillis. That's House Calls. We do that each and every Wednesday from 11 until 12. Now we get some room for you. What is on your mind today? The way to reach us for the open hour is 902-405-6000. If you've got a general thing that comment you want to make, or something that you've heard perhaps on the show that you've agreed with or disagreed with, whatever it might be, it's an open hour. That's what it's all about. It's about your opinion. 902-405-6000. Again, 902-405-6000. Something that perhaps some of you might want to weigh in on is this story, the permit that was issued to put on a concert by a controversial American Christian singer at York Redoubt has been revoked by Parks Canada. Several media outlets in HRM reporting this morning that Parks Canada was not putting the show on by the performer. It was a vendor, and that the federal agency has revoked the permit based on evolving safety and security considerations, based on confirmation of planned protests and input from law enforcement. Now, of course, the freedom of speech is at play here for some. Some people feel as though it's a violation of freedom of speech. Others feel as though this is appropriate, pulling the license for him to sing or the opportunity for him to sing at a Parks Canada venue. He's a strong MAGA supporter who in the past has spoken out against LGBTQ rights and along with abortion rights and ran unsuccessfully for Congress as a Republican in California. So what are your thoughts on this, folks? Is this a violation of freedom of speech and expression, or is it the right move? That or whatever else you've got on your mind on this Wednesday, the way to reach us is 902-405-6000. Again, 902-405-6000. An open hour when we come back. All right, what is on your mind today? The way to reach us is 902-405-6000. Again, 902-405-6000. Perhaps you've heard some things that have been discussed on the show that you've agreed with. Perhaps some things that you've disagreed with. It's all good. I want to hear from you. Again, 902-405-6000. That is the way to reach us. Again, 902-405-6000. One of the stories that perhaps you might want to weigh in on, the permit that was issued to put on a concert by a controversial American Christian singer at a national park here in Halifax has been revoked by Parks Canada. They say that they're not putting on the show. It was a vendor who was putting the show on, and that the federal agency has revoked the permit based on evolving safety and security considerations, based on confirmation of planned protests and input from law enforcement. People living near the popular park raised their concerns about the singer and strong MAGA supporter who in the past has spoken out against gay rights, along with abortion rights, and also ran unsuccessfully for Congress as a Republican in California. Tonight's show was to begin a tour of Canada that was scheduled stops in Charlottetown, Moncton, and Quebec City. So what are your thoughts on this, folks? Is this the right move? Do you think that Parks Canada should not have issued this permit in the first place based on this person and their viewpoints on some of the issues that I just pointed out? Or do you feel as though that it's censorship of some sort, of some kind, or perhaps of just plain out censorship? Perhaps that's how you feel about this. And when it comes to freedom of speech and expression, does your attitude towards it, is it often linked with your own views? So I guess what I'm saying is that people will cry foul if they feel that freedom of speech is infringed upon. But if they don't agree with somebody and somebody's views, then they're okay with it. So what are the lines here? What are the lines when it comes to freedom of speech and expression? And what's at play here, folks? What are your thoughts on this? Or anything else you want to get into? Again, 902-405-6000. Again, 902-405-6000. Quick email from Mark, then I'll go to the phones. Mark says, cancel culture at its finest. So as a society, if we don't like people's personal opinion, we simply cancel them. Well done. I find they also use the excuse that it's a safety or security issue with a spineless society we become. I don't particularly agree with this singer's personal beliefs, but that doesn't mean I want his career as a musician destroyed, but I'm betting there are many holier than thou folks out there who do. So, interesting comments. Again, perhaps some of you out there listening say, look, I don't agree with his viewpoint and his stance, but I don't think that should result in having this concert canceled. 902-405-6000. The fact that it's at Parks Canada, that it's federal territory, does that matter? Should that play into this as well? 902-405-6000. Mike, what's on your mind today?
Boy, aren't you lucky? 2 days in a row. You know what? I wasn't going to talk about it, but it is censorship. I mean, the country has done this on numerous occasions. We wouldn't let Martha Stewart into Canada because of her criminal record. She never hurt anybody. She just into tax fraud or whatever. But, and then we had, there was some rap artists that were invited in that had criminal records. So the rules just kind of fluctuate and bend for what we're in favor of and what we're not in favor of. So you kind of got to go one way or the other. This whole wishy-washy. Where how do you pick and choose? So anyway, but I do want to talk about that sentencing today of the two people that were accused of organizing the whole truck protest.
Yeah.
And I'm disappointed. I really am. And I think my opinion is Mark Carney should step up and dismiss that case. Trudeau used the Emergencies Act. That was investigated, and it pretty much came out and said that was pretty weak, spineless kind of thing to do. And I think it sent a strong message to Canadians is that don't get the notion about protesting us because we'll come down on you. So I feel bad for those two, and they can each get up to 8 years. That's ridiculous. We have to be allowed to protest. I mean, I think it's one of our rights in the country. Anyway, that's pretty much all I had to say today, Todd. I feel bad for those two, and they had a cause and they protested, and a lot of people got. And when you watch the films, and they were going on, oh my God, they're doing this and they're having big crazy parties and everything. People were coming to them and helping them out and bringing them diesel and for their trucks, and they had barbecues and sing-alongs. It wasn't violent at all. It wasn't violent until it turned into an Emergencies Act.
Well, Mike, I think that was part of why the public sentiment turned against him in some ways, because I'm going to disagree a little bit. Is that for some it was a party, and for many it did become a party because there was the hot tub and all that stuff, and I think I think that people, I think that probably too many people got involved who weren't there for the right reason, for the reason that you're talking about, and because it was becoming an event and wanted to just be there to party. And I think that didn't help their cause, I guess, Mike, is what I'm getting at.
Yeah, no. And it's kind of the same thing as the first topic. And it's like, certain protests have gone on for, I remember the one where the train tracks were being littered with stuff and I mean, they wouldn't go in and chase them fellas off. So, I think we're like I said, we're very wishy-washy on who we talk to or who we pick on or who we say, no, you can't. But I think it needs to be a little more black and white than that. I mean, it is freedom of speech. And the way I look at it, Todd, is I'm not going. I have no interest in seeing this person. So just don't go. Don't participate. Yeah. Anyway, buddy, you have a great day, and we'll talk again.
All right, take care. 902-405-6000. Rafe is giving us a call. Hello, Rafe.
Hi, how you doing?
I'm well, you?
Yeah. Good. I just want to make a comment on what your previous caller was saying. One of the things he said was Mark Carney should just dismiss the case. The Prime Minister has no right to interfere in the justice system. Mm-hmm. That's called a king. The Prime Minister can't just pick and choose what court cases go to court. I mean, that's just ludicrous. And the other thing about the protests, there's a big difference between a peaceful protest out in front of Parliament Hill with flags and chanting songs than blocking up a city with diesel noise, fires going. They had campfires, they had pools. People were trying to sleep. It went on for whatever it was, 3 weeks. There's a big difference between a peaceful protest and what that was all about. And the court system did what they had to do. If these people were found innocent, then it'd be fine. But they were not found innocent. So I think we have to leave that up to the courts. I mean, we're a country of laws, so let's obey the laws that we have and obey the justice system to do their job.
Well, yeah, I agree that we're a country of laws, but there are times when protests kind of, and again, it depends if you support the protest or not, right? I guess what I'm getting at is public unrest and in the past, when you look at the civil rights movement in the United States, and there have been times when there have been disruptions to society in order to make a point and to get their point across and to get government's attention and policymakers' attention, and it's not always deemed to be the wrong thing to do. So I don't know that simply saying they broke the law, so therefore it's not a lawful, or rather they should be condemned for it, is always applicable, because there are times when the movement has been considered just, and therefore that has been considered appropriate behavior. See what I'm getting at, Rafe? Or am I not making any sense here?
I see what you're getting at. Their motivations may have been just. They may have been protesting COVID vaccines and wearing masks and all that. That's absolutely fine, and you can protest that till your eyes bleed. But you can't disrupt a city and people's use of their own city for 3 weeks with horns blowing. If you want to protest, that's fine. Go in front of Parliament building and do your protest in front of because you were protesting against the government, not the city and the citizens of Ottawa. The citizens of Ottawa did nothing to those people, to the people in the protest.
No, I understand that, but that's the way to get attention. It's like a strike, right? It's like when CUPE strikes or whatever strikes, they don't have issue with the public. They have issue with their employer or the government or whoever the employer is, but the public becomes the pawn, right? And that is the nature of these things. We get caught up in it because when we get inconvenienced, we let the politicians know, and therefore that's how it gets traction.
Yeah, I understand that, but I come back to the fact that there's a huge difference. If the postal union strikes went on and they went in front of they decided to invade people's neighborhoods and pick different neighborhoods for 3 days in a row and blow horns and honk horns and have bonfires in the street, that would be illegal. Because that's not a peaceful protest. Yeah, for sure. The union does their thing. They pick at a place and they go around in a circle and they have their signs and they'll block a sidewalk for a bit, but they do not carry on the way there's a huge difference. There's a way to do it.
No, I get it. I get it, Rafe, and I'm not trying to be argumentative. I'm honestly not.
No. It's a good discussion.
I'm just trying to have a broad discussion, but I think you make some valid points. Okay, pal.
Thank you.
Thanks a lot. 902-405-6000. We'll continue with your calls when we come back. This is call 902-405-6000. Again, 902-405-6000. This email in connection with the canceled concert at the National Park here in HRM. This comes from Tim. Says, I totally disagree with the views of the singer, but the reasons for canceling the show were as hollow as Houston's reasons for missing the Pride Parade 2 years in a row. Furthermore, Houston continues to demonstrate he's all about power, and Fillmore does as well. Leadership is not about the abuse of power to impose your will. And yeah, folks, listen, security concerns, no, let's call it what it is. But that's the nature of this type of thing. They're not going to come out and say we're canceling this because of the backlash, because people don't feel as though the views are what they should be for somebody performing in a national park. They're gonna come up with another reason, and perhaps there's something to it. I suppose there would have been quite a bit of unrest and some protest, and perhaps there's some validity to some of that. 902-405-6000. That is the way to reach us. Again, 902-405-6000. Alan, what's on your mind today?
Yes. Good morning, Todd. Love your show.
Thank you, sir.
Thanks. My main concern about this concert that they canceled, I'm all for canceling it. I mean, you're right. I see through the reasons and all that. My opinion is we don't need somebody coming up here with the Republican values, okay, and preaching it under the veil of the church. If he wants to exercise his freedom of speech, okay, our freedom of speech guarantees our people that live here in Canada. If he wants to practice his freedom of speech, he's welcome to do so in his country. But we don't need, especially with tariffs on here, people's tempers are high and everything else. We're not talking about a Boy Scout camp coming up here, okay? We're talking about somebody who's against the LGBT, okay, basically racist, from what I can understand, from everything I read. And it's just Trumpism, out and out. We don't need that here. And whatever reasons they want to use to say they cancel it or get their fingers out from underneath that pile of crap, good for them. I'm glad they did it.
Okay, Alan, let me ask you this question. Let's say that this was a Canadian singer or somebody from Nova Scotia who had these views. Would he or she still be should he or she still be canceled?
No.
No,
so he'd be protected by our freedom of speech.
No, I'm not sure that's how it works. I'm not sure that's how it works. I don't think it depends on whether you're a citizen or not. It's like the Criminal Code of Canada. You can be a foreigner and commit a crime or not, and it's the action that is the crime. So I don't, and maybe I'm wrong, but I don't think it matters whether you're a Canadian citizen or not. I think freedom of speech is protected, regardless whether you're from, or it should be a consideration, I should say, whether you're a Canadian citizen or not. I could be wrong, but I that's my take on it.
Yeah, we each have to agree to disagree there. I mean, they have their way of life, which is different than ours, basically, since Trump got in. And I feel that our environment right now is fired up enough without having foreigners coming in and firing it up even more.
Okay, thanks for the call. Take care.
Thanks.
902-405-6000. John, hello.
How you doing, Todd?
I'm well, you?
Good, thank you. Just on the whole Tamara Lynch possible 7-year sentence, I'll start by saying I don't agree with how that protest went down. Shouldn't have went as long as it did. I mean, there's a lot of blame to put on the government, who used it federally anyway as a leverage to divide people. But in any event, 7 years for that, for 3 weeks. I mean, I read an article this morning in the Post, a guy out in Edmonton who attacked 3 people and in the transit system, got out on bail, and then murdered a guy while he was out on bail. And they let him plead to manslaughter, and he got 7 years. So I understand people who were pissed off with what went down, whether it was anti-vax or whatever you want to call it. But But how do you equate a 7-year sentence for organizing something like that, and the minimal sentences? That's just one example of somebody murdering somebody else and getting 7 years. Just doesn't make any sense to me.
Yeah, I think that's a fair comment. I do. I think that's a fair comment, John.
Yeah, I mean, put her on probation for a bunch of years. Do whatever you're going to do. Mm-hmm. But I mean, like I said, I agree with your former caller who said protest all day, but you get an outsized effect when a limited number of people by bringing trucks in and setting up a camp versus going up and marching on Parliament Hill. And if they marched on Parliament Hill, there might have been 5,000-10,000 of them. That's all it would have been. You know what I mean? So versus if it was really a larger social issue. So I guess that's all I have to say, sir.
Okay, John. Appreciate the call. Take care.
Thank you.
902-405-6000. Donna, hello.
Oh, hi. Thanks for taking my call. I had no intentions of calling today, but there was a caller on talking about the Freedom Convoy protest and whatnot. Oh, you know how they disrupted the city. What about these pro-Palestinians that have been protesting for a year and a half, calling for death to the Jews, burning Jewish property and destroying it, and blocking traffic, doing this and that? That's been going on for a year and a half. And nobody, and they've been spitting on people, doing this, doing that.
Okay, you're generalizing, Donna. You're generalizing big time. You're saying they're spitting on people. Look, we don't know. Like, I'm not saying that hasn't happened, but wait a second. But to suggest that everybody who's pro-Palestinian is acting in the way that you're saying is not fair. I'm not saying it hasn't happened.
The ones that are out protesting.
Okay, no, but the ones that I've seen them protesting here in Nova Scotia or in Halifax. I've been downtown when they've been protesting, and I never get spit on. Okay, and I never got traffic disrupted. So I'm not saying that doesn't happen. But
I watched the news. It's up in Ontario. It's a real mess there.
Okay.
And I'm not sitting or whatever. I'm just quoting what I saw on TV. But and they somebody burned a Canadian flag at one of these pro-Palestinian ones, and they've been calling for death to the Jews. That's a common thing, and they've been destroying up in Ontario. I'm saying the ones here are peaceful. You can protest peaceful, and you get more sympathy from people if you're peaceful. But none of them, very, very few of them have been charged. That's my point. And to give these people, these other ones, 7 and 8 years, give them a probation for 2 or 3 years or something. But murderers, for goodness sake, don't get 7 years nowadays.
Okay, Donna.
The point I was trying to make.
Okay, thanks for the call. 902-405-6000. Look, I'm not saying that some of these pro-Palestinian rallies have not gotten out of control and are not over the line and distasteful and violent and all, because some of them are and too many of them are, but not all of them are. That's my point. I just want to be careful that we don't just paint everybody with the same brush. That's all. 902-405-6000. Again, 902-405-6000. That's the way to reach us. Tim says this via email, says, I feel that regardless of how we feel about this performer, it feels like hate and intolerance won out against hate and intolerance. And that's an interesting comment, right? Sure, I suppose. But it comes down to freedom of speech, freedom of expression. And what are your thoughts on this? We're having a good conversation about this, folks, and that's what it's all about. Opinions and various opinions. That's good. 902-405-6000. We'll continue with your calls when we come back. All right, continuing with your calls. The way to reach us is 902-405-6000. Again, 902-405-6000. That is the way to reach us. Let's talk to Mike. Hello, Mike.
Oh, hi, Todd.
Hi there.
How you doing? First, I'd just like to thank you for facilitating these discussions. I mean, this one today, it's kind of a key one, really. Slippery slope.
Yep.
Yeah, I mean, I think there's two issues here. The broader issue, of course, free speech, all that. The other issue, too, is, the agency, the parks, like Canada Parks, federal agency.
Yeah.
I mean, if they planned this, it's a matter of integrity for them. I mean, call it 11 o'clock at night, major event, probably lots of people involved. How do you square that? Promise is a promise. So, but certainly, if there's any danger to the public, that's of course a concern. But it's not a small issue, really. It really speaks to a core issue that's at large today in our society right here in Canada and here at home. So it's certainly a tough question, that's for sure.
Yeah,
deserves to be examined. Will Parks Canada be accountable for this? Shouldn't they have done their homework before they made this last minute decision? It sort of sits at their door. And to haul in the authorities and say it was unsafe, this is something that, speaks to competency, really, in terms of Parks Canada. Did they do their homework? Who set this in motion? And then of course, to stymie it at the very last minute, and of course, this individual from the United States, he may have a background, but they should have probably vetted him and checked it out. That's a huge venue, and it has a commanding view of the port as well.
Right.
Should have been, more carefully considered, I think. And will there be accountability? To put the public through this as well.
Sure.
It speaks to, competency. Like do they just get a pass? It seems like these free passes are getting handed out all the time to those who are in positions of influence and responsibility. That's all I have to say.
Yeah, I think you make a good point in what happened. How did Parks Canada approve this? And then, like you said, in the very, very last minute, as the public backlash started to come in, they pulled the trigger or pulled the pin on it. So I think that's a good point. What was the process? What was the procedure? How did it happen that they got approved in the first place? Did they vet this person at all? And I would bet, Mike, probably not. Probably some vendor came in and said, look, we got this great show, it's a great concert, and American country singer, whatever, and they probably did not vet him at all, I would bet, Mike. That's my instinct.
Yeah, and here we are. And, the public, whether or not the right decision was made is moot in a way. We're suffering here in this country from, an overwhelming sense, the public has, of incompetence in government and the bureaucracy.
Yeah.
And this is just sort of another example of, politicians or those who have positions in authority who decide that they're going to err on the side of caution. The phrase "an abundance of caution," that's just not going to cut it much longer, I'm afraid. And the thing is, what it does is it causes strife, it causes disagreement, it causes ill feeling within the public, because there are people who have different points of view. And it seems to me, anyway, that oftentimes the abundance of caution argument comes down on the side of those who wish to insulate themselves from the realities of discussion or the realities of considering other points of view that may be valid, may be very valid.
Yeah.
Although in this case, argue it as you will. It's one of those cases where, in the general sense, it seems to indicate it's a symptom of a larger problem that maybe should be examined more carefully even than this guy's religious views or his political views. Anyway, it's something that deserves some attention, I think.
Yeah, Mike. Like you said, if Parks Canada would have received the application to have the show and would have just said, look, we're not going to issue a permit, it would have been the end of it. That would have been the end of it, right? But because somebody at Parks Canada obviously didn't vet it, didn't do their job or whatever, therefore we've created this controversy, and people get upset, and people become even more entrenched in both camps. and I don't know that that's good for I don't know if that's good for anybody.
Exactly right. And I thought that, really, I mean, the folks who are making policy, or the folks who are managing culture and information, who are creating the standards that we live with, and are supposedly guiding us through these deep waters, in our contemporary, the world we live in. If all I can say is where there's smoke, there's fire. And maybe they need to take a look at some of their decision making, and they need to realize that there needs to be maybe better planning.
For sure.
That's it.
Okay.
And for the public to go through this, I mean, who knows? I mean, maybe those who are on the right, or in terms of the believers, or whatever, or music enthusiasts who are looking forward to, or country music enthusiasts, or people who are into gospel. I mean, they're probably wondering, like, are we getting balled up in the same camp as people who can be canceled? And these suspicions are not healthy, I think.
Okay, thanks for the call, Mike. Appreciate it. Take care.
Okay.
902-405-6000. Kevin, hello.
Hello, Todd.
Hi there.
I've been just sitting here. I'm an old guy listening to the radio, and your last caller seemed to be extremely smart and connected. Like, remember what Rick Howe said? If you're not outraged, you're not paying attention, right?
Yeah.
Well, you know what? It seems like if something's not debatable, it's likely propaganda. But it doesn't mean that you can just stomp your foot and silence somebody. That's what they did over in Russia with Stalin and Hitler, right? We don't want to go there. And it's I don't know. It seems a little crazier every day. You just wake up and you hear something Tuesday, and then it's Wednesday, and it just sounds a little more crazy going on. And that last guy, he was a breath of fresh air for somebody my age that just watches what's going on. And I think people are waking up, but it's taken a long time. And it's just like, Todd, if you didn't like dogs, would you go to a dog show? It's the same sort of thing. I don't know this guy.
Mm-hmm.
I'm not going to villainize him. If I went to his concert and then he said some stuff that was, quote, racist or whatever, then, well, what do you think?
Well, look, I'm not quite sure what your main point is, to be honest with you, but
well, you don't need to cancel somebody if you don't agree with them. Just like there's probably lots of people out there that don't agree with a gun show, for instance.
Mm-hmm. Yeah,
but
that's true.
Don't go.
Yeah.
Right. Don't go.
Well, I guess Kevin, I guess the element to this story that is another layer to it is that it was at a national park, which is of course owned by the federal government, which
everybody.
Right. So I guess the federal government feels as though it has some obligation to stand up against somebody with these extreme views, because we in Canada are supposedly a progressive nation and accepting and tolerant and all that stuff. So what are your thoughts on that? Does that add to that?
I don't know that he's got views that how do you tell the views he's got?
That's not up for debate. He is against the gay community. He's been outspoken on it. He's against abortion rights. He has said some very, very controversial things, which have been racist comments he's made. That is not up for debate.
Well, I like everybody, but until I don't,
Yeah.
like I'll give everybody the, the chance. But it's just getting silly. I don't know. And one more comment,
Okay.
Todd, about the Tamara Lynch and Chris Barber. That's beyond. Like, what are they going to send them to, the gulag? I mean, Trudeau could have stopped that thing. It didn't need to go on 3 weeks. All he would have had to do was meet with these people. And I think, he didn't do that.
Yeah, that's an interesting comment. Okay, thanks, Kevin. Appreciate the call.
Okay, thanks,
all right,
Todd.
take care. 902-405-6000. We'll continue with your calls when we come back. All right, continuing with your calls. The way to reach us is 902-405-6000. Again, 902-405-6000. Will's giving us a call. Hello, Will.
Yes, good morning. How are you this morning?
I'm well, you?
Terrific, great show.
Thank you.
You're welcome. Just want to make a few points regarding the gentleman who was to perform. I don't know of his views or much on his background, but in the matter of free speech, I think a lot of what's being observed south of the border should alarm a lot of us. Fortunately, it's not happening in Canada, but looking at the record right now, briefly, the Trump administration has made specific, significant decisions without congressional approval to restrict overall funding for major institutions where people can speak and offer their views plainly with right to free speech, actually singling out individuals on the basis of either recorded text of their speeches or protests on campus under the guise of the idea of protecting against anti-Semitism, which unfortunately is completely misleading and it's disingenuous, because unfortunately those who are impacted on the campus, which ultimately would affect those of Jewish descent, because they cannot then openly even talk freely about matters that affect both Palestinians and the Jewish state. And I think it's dangerous and deeply anti-democratic what the government is doing there. So we should be really thankful that this doesn't even take place in our own country. And we should always observe the importance of freedom of speech.
Okay, fair enough. Thanks for the call, Will.
No problem.
Appreciate the comments. 902-405-6000. Greg, hello.
Good morning. How are you?
I'm well, you?
First-time caller.
Great,
I just
thank
wanted
you.
to comment on this canceled concert. I agree totally that it was canceled. I'd actually take it a step further. I wouldn't even let him into the country. Why would we even let this guy in? He's associated with MAGA. The whole thing with MAGA, they're talking about making Canada the 51st state. They've instituted a trade war. Just beyond the cultural stuff that he spews, the anti-LGBTQ and, race.
Sorry, Greg, you still there?
In some cases, we've heard about people being detained at the border. But there was a lady who was in a holding cell down in California, in Arizona.
Yeah.
Why would we extend the courtesy of even letting them into the country? Is my view.
Well, like I said yesterday, what would have happened? Do you think if when he entered the I don't know if he came in the airport at Halifax or what entry point he came in, if he would have been detained and treated in the way that some of our Canadians have been treated, to your point, south of the border, the backlash and the outcry that would have ensued from the Americans, and probably Donald Trump himself, it probably would have reached him, would have been off the charts. And that's complete
You'd be
hypocrisy.
labeled as difficult again.
Yeah. Exactly. No,
I don't understand why we would.
Sorry, Greg, go ahead.
Extend any courtesy. Yeah, I just wouldn't extend any courtesy to this guy.
Well, look,
From what I've read about him, I don't know a whole lot, but not the type of guy we need in the country.
Well, I'm not sure that I would go that far with you, but I get your point. And like I said, if people entering the United States, political scientists, professors, media people, whomever being detained, going through, and anything that they find in the phone, which goes against Donald Trump, being detained and it's in some cases not allowed access to the country. It's definitely troublesome. And Greg, listen, I can see why you might feel that way, but I don't know that would be something that I would support, not letting him in the country at all. But I take your point, I guess is what I'm getting at.
That's true. Like, I guess when it comes right down to it, it's just more of a tit for tat. I don't support that type of heavy-handed, action at the border. Like, I think people should be allowed to come in, fairly freely, as long as they're not criminals, I guess.
Yeah.
But it's just kind of a response to the way the Americans are treating us, and we extend them the courtesy that it feels like they deserve sometimes.
Okay, Greg, appreciate your comments.
Okay.
Take care. 902-405-6000. Daryl, hello.
Hey, Todd, how's it going?
Well, you?
Not too bad, thanks. I just wanted to talk about some of your callers prior about this Litch and Barber thing.
Mm-hmm.
The judge hasn't even made a decision yet, and people are up in arms already. I mean, the prosecution asked for 7 to 8 years.
Yeah,
the
that's
defense said 0 and time served and whatever else, probation. So maybe we need to wait until the judge makes a decision on this. The fact that the prosecution asked for that much time is no different than the other guy that went through. I think it was last year. He got like time served and a little bit of probation or something. The prosecution asked for 10 years for him. And the judge said, no, time served, probation, and whatever. So I think we're getting a little bit out over our skis here when it comes to that sort of thing. So maybe we should just wait until the judge actually comes out with a decision.
Yeah, that's fair. It's a fair comment.
Yeah. So that's and as far as the concert thing goes,
yeah,
I kind of agree with your previous caller. Personally, I wouldn't want him in my country.
Mm-hmm.
The fact that he is a Krystle fascist hate monger, he just spreads craziness about LGBTQ people, racism, other cultural stuff. It in a national park, I mean, the fact that it got booked in the first place was nuts.
Yeah.
But and I think what's pissing people off is that it got closed down right at the very end.
Yeah, that's right. That was
probably
poor.
Yeah,
that was not a good look for sure.
Right, exactly. No, I agree with that.
Yeah. Okay, Daryl, appreciate the call.
Thanks, Todd.
All right, take care. 902-405-6000. Lynette, hello.
Yes, can you hear me okay?
Yes, I got you.
All right. There's an old joke that goes, it's probably a bit of a parody, but it goes that 3 dogs, an American dog, a Biafran dog, and a Russian dog are hanging out. And the American dog says, when I want some meat, I just bark. The Biafran dog says, what's meat? And the Russian dog says, what's bark? So this is somewhat what we're contending with right now is, do you let someone bark or not? And I understand about the vetting that might have prevented all of this, but in my view, everybody has something to learn from one another. I certainly don't approve of anything this person stands for. I don't know much about it, but from what I've heard, it's controversial, and it's not necessary. It just fuels the wrong spirit. But nonetheless, we all have something to learn, and if he was allowed to perform, perhaps there would have been some sort of a breakthrough. We don't know. So that's my opinion, Todd. Thank you.
Okay, appreciate the call. Gordon, quickly if you can.
Yeah, I'll try you fast. Thanks for taking my call.
Sure.
I just wanted to ask about the tariffs on the Chinese electric vehicles by Canada.
Yeah.
100%.
100%, that's correct.
How come nobody says anything about it?
Well, people do say things about it. People are raising the issues about it because it's like you said. If the government wants us in EVs, and yet you're blocking out the most cost-effective EV in the world for and good EVs from what I've read, the Chinese have really built a good car, a good EV, and to protect the Canadian auto industry. And tell us that we have to pay tens of thousands more dollars for an EV to protect the Canadian auto sector and Canadian auto builders. To me, is it's a valid point, Gordon. I think that it's definitely something that people should be concerned about. And if you want me to be in an EV, then then open up the market to Chinese EVs, because that's going to be the most affordable way that I'm going to get in an EV.
Well, I think that the Canadian taxpayers paid money, big money, to the automakers in Canada.
Oh yeah, billions of dollars.
Yeah.
Yeah.
So we're paying both ways.
That's right. Exactly. That's right. That's a good point. Gordon, we're out of time. Thanks, pal. Appreciate the call.
Okay. Thanks.
All right.
Yeah.
Take care. Thanks for the calls, everybody. We appreciate it. We'll open the phone lines again tomorrow between 11 and 12. Thanks to Vanessa Van Ness on the other side of the glass of the control boards, doing a fine job. As always, we're back tomorrow at 10 o'clock. See you then.